With sudden spike in cases of heart attack deaths, Karnataka government has now made each case legally notifiable. All healthcare providers, hospitals, clinics must report such cases to the State Health Department within 24 hours, followed by a mandatory autopsy to determine the exact cause of death. Move follows a sharp rise in sudden cardiac deaths, particularly among young and otherwise healthy individuals. A technical committee led by the director of Jayadeva Institute submitted the report prompting the decision. Karnataka Health Minister announced the decision on Monday, the 7th of July. Dinesh Gundurao, they cited a worrying trend of young people collapsing suddenly due to heart attacks. The step is aimed at strengthening public health policy to understand the cause and to prevent future cases. The sudden heart attack deaths in Hassan and Chitradurga drew the attention of the health experts, and the Karnataka, their government, sprung into action to draft a policy to look into these cases, especially fatal heart attacks in the youth. Let me quickly go across to Dr. Sanjeev Gera, Director and Head Interventional Cardiology, Fortis Healthcare. Thank you very much, Dr. Sanjeev, for joining us in fact, on News 9 Special. Dr. Sanjeev, what do you really make of Karnataka's decision to make sudden cardiac deaths legally notifiable? Is this a step in the right direction? Would you say that?
So basically, like you know, that we were getting so many young cardiac deaths over the last few weeks or months. And especially from one area, there was many deaths, young cardiac deaths. So the committee decided to make a rule mandatory that every young cardiac death should be notifiable, and it should be investigated further if there was no reason. So I think this is a right approach, because we were not actually able to find out the reason why there were so many cardiac deaths, despite having no actually reason for any heart disease or any previous history of heart disease or any risk factor for heart disease. So maybe this will help us finding out the reason why this is happening, whether it is because of pollution, whether it is because of any pesticides or any other non very known risk factors like diabetes, high blood pressure, smoking, alcohol, traditional risk factors. So I think this is a right approach, and every sudden cardiac death, not death because of heart attack, every sudden cardiac death below 40 years of age or any young sudden cardiac death should be notified to the government, and then they will be able to find out the reason by doing autopsies if justifiable, if there is no reason for that.
Dr. Gera, why is it important to do an autopsy in every such case, especially when the person has no prior history?
So if there is no prior history, then it is actually essential. If you have prior history like diabetes, or if patient was a very heavy smoker or a known diabetic, or when he was having some problems in walking, like symptoms of angina or heart failure or maybe breathlessness, fatigue, any type of symptom. So this means that he already had a substrate, and then he ignored those symptoms and he collapsed because of heart attack or sudden cardiac arrest. But when you do not have any known risk factor or any reason for cardiac death, I think then that time it is very mandatory to find out the reason, what actually happened, whether it was the artery which was blocked or whether it was the muscle which actually muscle was ruptured, or there was rupture in the artery, or there was a clot in the artery, maybe because of long COVID syndrome, because it is very rare to have all these heart attacks or clot symptoms, clot deaths because of COVID after 4 years of COVID. So that is why it is very mandatory to do autopsy. But yes, it should not be a blanket rule. It should be, should be applied to those cases when you don't have any traditional risk factors.
Okay, let me ask you this. Practically speaking, doctor, how do you think this will be sort of, it's going to be very difficult when we speak about rolling it out on the ground. How is this going to be rolled out on the ground?
It is very difficult actually for a grieving family when someone has lost a young relative, or so it is very difficult to convince them for autopsy. But at least it should be notified to the authorities. At least they should have a data how many people are dying or have died because of sudden cardiac death, whether it was a heart attack related death or non-heart attack related death. Maybe it was some poisoning or maybe an exposure to some toxic substance. So you need to find out the reason. So that is why autopsy is so mandatory. But applying it to every individual, it is going to be a difficult thing, and there will be a challenge for authorities to implement this blanket rule.
These are sensitive moments, Dr. Gera. How can the medical fraternity really ensure families don't feel blamed or further traumatized?
Yeah, it will be actually, about counseling only, so as to find out the reason, because maybe the person was having some genetic factor, and maybe his sibling or anyone else in the family is carrying that gene, or maybe that pathology. So it will help us in finding out the reason why it happened, so that we can apply to their family members or maybe some other people around, so that we know the exact reason. And it is actually, for the initial few cases, it will be, I think it should be mandatory.
Right. Dr. Saab, let me ask you this. Is there a way to make this process more compassionate while still following the protocol?
It is very difficult actually when someone has lost a close family member. So compassionate, yeah, definitely we can help them, we can counsel them, we can tell them this could, there was no reason for him to die, and this can happen to any other in the any other member in the family. So it has to be, there has to be a doctor involved, a cardiologist involved, some counseling people involved in that, and some psychiatrists can also, counsel them. So it is going to be a challenge, I told you. So, but there is no way out actually, and they lost around 6 to 7 young people in a month with this sudden cardiac death. So we need to find out the reason, and it is all over country actually. We are getting so many young cardiac deaths. But when you have a substrate, when you know that ECG was showing a heart attack and the patient died, I don't think that it actually mandates an autopsy. It can be notified, definitely. We should have a data. But autopsy should not be mandatory when you had an abnormal ECG or when there was classical chest pain leading to heart attack and causing sudden cardiac death. So to know a reason in unknown death, autopsy is actually mandatory.
All right, let's also speak about the rise in sudden heart attacks, Doctor. We're seeing a lot of young people, students, IT workers suddenly dying of heart attacks. What's really going on? Is there a link between these sudden deaths and post-COVID complications?
No, it is very clear. COVID actually led to clot formation in blood vessels, and it was true for initial 6 months or 1 year. But after 4 or 5 years down the lane, I don't think that COVID should be blamed for all these deaths. And even now, there is a data from ICMR, one study from ICMR, which revealed that there is no linkage between COVID vaccine and cardiac deaths. So I don't think COVID is related to that. But yes, it is our bad lifestyle which is actually causing all these deaths, and especially when you have risk factors. If you talk about the traditional risk factors which have now come up, initially around 10 years back, there was very less of pre-diabetes. Now, a lot of people have pre-diabetes, diabetes, high cholesterol values, weight has gone up, smoking has gone up, especially in women also. Then physical inactivity, we are working from home. So all these things actually changed post-COVID era. And this is the reason what I think that young cardiac deaths are occurring, and it is because of early aging. You can say we are getting more of early menopause, and we are getting more of early aging. So when you are 40 years old, but your vessel is or your heart is 60 years old, then it is definitely early aging, and we are getting heart attacks. So any person who has a family history of heart disease, whose father had got a heart attack at 60 years, now he is getting heart disease at 40 years age. So it is just early aging, but you have to move after. You have to look other at the other risk factors also, like pollution, pesticides, and so many things which were actually earlier not known to cause heart attack or heart diseases.